Now, and joining us once again, just virtually now, is Dr. Pamela Cothery. He is the Chief Medical Officer for Dignity Health Central California Division. Good morning, Dr. Cothery. Thanks so much for joining us virtually.
Good morning.
So let's talk about something that we've seen in the news over the last day or two, and they're the new symptoms that are being reported with the coronavirus, something that we really haven't seen at least since the beginning of this. And a lot of people are talking about losing their sense of smell and taste. Are those now symptoms of COVID-19?
Yes, and actually as this virus progresses, we're going to see some more symptoms. The loss of smell has been shown in China as well, and also there's been quite a few cases in Germany. The loss of sense of taste is still relatively new and not as common.
Now, you said that we could see new symptoms. What does that mean as we, go forward? Since we are just now kind of seeing the beginning of this pandemic here at home, here in the U.S., this is kind of new to us, at least, and how we're dealing with it. What does that mean when you talk about we could see new symptoms?
Well, we've already started to see a lot of GI symptoms. Upset stomachs, diarrhea, vomiting, and that is starting to account for about 50% of the symptoms that people are experiencing, as well as the common symptoms, the cough and the shortness of breath and fevers as well.
Now, we saw yesterday it was a big number. 10,000 new cases of coronavirus across the nation. That is a big number. It's a big jump. Where are we when we talk about flattening the curve and as we see this number continue to be on that exponential track?
Well, I still think we're on the upward trajectory right now. We still have, just in Kern County, we have several cases that we've tested that have not resulted back. As I suspect there are a lot of those same symptoms, similar issues in other states as well. So as the testing gets better, the resulting gets better, we should see more cases come out.
Now, there was also a number showing that the U.S. is seeing the death rate double, for almost double from day to day. Is that the case, and why is that so much higher than other countries that weren't seeing that high of a spike?
I think partly it's, we had a backlog of testing. So we have a lot of tests that weren't resulted. So as these tests come out, we're starting to see, more and more people get positive, but we're getting these people a little later. Whereas once you get the testing like we will in-house, hopefully this week at Bakersfield Memorial Hospital, we'll be able to get these people in quicker and hopefully get them on some kind of a treatment sooner as well.
One of the things that we heard from Public Health was they showed a map of where the confirmed cases are in Kern County. Now, of course, it's important to note these are confirmed cases of COVID-19, meaning that there could still be cases out there. We just don't know the results of the test yet. But one of the areas that stood out was what's considered Bakersfield West. That includes Southwest Bakersfield, the Rosedale area. And a lot of people see that and may think, oh, the virus is primarily in Bakersfield West, and I'm still needing to go to the grocery store. I'm still getting packages from places like FedEx, UPS, whatever it may be. Is Bakersfield West at a heightened risk of this virus?
I don't think this virus discriminates by geography. I think maybe Bakersfield West is hit harder because people that live there were probably getting tested a lot. The area is more of an affluent community, so there may have been more travel, people visiting from out of town as well. So it's hard to say, but I don't think that's an epicenter there.
Do you think it's, again, just too early to tell, kind of how this affects everyone just because we're still in the early stages of testing primarily?
I really think so.
Okay.
I really believe so.
Now, again, we talk about these essential businesses that are open. Of course, one of them being, dine-in is not allowed, but takeout is allowed. You can still go to the grocery store. And you talked about how, keeping that distance is still important, but as we've seen, grocery stores are still packed. And regardless, even if they're not as packed during some parts of the day, you still have to get in line and check out. So is it possible for people to still get this virus if they're going to places like the grocery store? And if you still need to go to the grocery store, how can you protect yourself so you don't get the virus or lessen your chances?
So the answer to your question is yes, you still can get it at the grocery store. The best way to protect yourself is to try and avoid big crowds. So if you see a long line, step back a little bit. The other big thing is also, we've been talking about this time and time again. Do not touch your face while you're in there, because you may be touching something that may be contaminated with the virus. The shopping carts may be contaminated. It's hard to say. So try not to touch your face at all. And as soon as you get home, wash your hands.
I want to talk about something that we heard from Governor Gavin Newsom last night during his daily briefing. He talked about how half the cases in California half the cases of COVID-19 that have been tested positive are between the ages of 18 and 49 years old. When you hear that number, that half of those cases are between that age range, what is something that strikes you?
I think it's that age range may not be practicing some of the social distancing. And I think, we had some data from China that it said, that age range wasn't getting affected as much, or if they did get an infection, it would be a very mild infection. We're seeing the opposite here in the United States. That age range is getting severe symptoms as well.
Do you think we're going to continue to see that as we again continue to see the timeline push forward here?
Unfortunately, I believe we will see a surge as these tests come in, but I'm hoping that some of these, people in that age range and the elderly as well continue to social distance.
I want to ask you, get your opinion on something that we heard from the president yesterday, and he said that he is encouraged, he's really trying to push for this, for things to get back to normal by Easter. Now, a lot of health officials say that's not going to necessarily be the case because we are still on the upward trajectory of the curve. What are your thoughts on possibly getting things back to normal, or at least starting to get past the, just getting past the 15-day mark? Can we see things maybe get back to normal by Easter?
I really wish we will be able to. Unfortunately, like many of the other healthcare providers, I don't believe it will turn around that fast.
All right, Dr. Cothery, thanks so much for joining us virtually. I think this is going to be the new normal here, so we do appreciate taking some time for you to talk with us this morning.
Absolutely.
All right, we'll be back.